Great. Okay, so let's just go ahead and jump into our agenda for the day. So we will start off with some introductions, introducing you to the organizations who are involved in administering these awards. We'll provide you some background and go over the RFA in detail, including the award components, expectations, priority areas, eligibility criteria, the timeline for the award period, and then go in depth on completing the application. We will have a Q&A at the end, and then finally, we'll go over some additional info on how to schedule office hours and submitting to the FAQ. So just like I announced up top, please please remember to remain muted. This webinar is being recorded, so to preserve sound quality, we just ask that you keep yourselves on mute. If you do have questions as we go along, please be sure to enter them into the chat box. We will answer questions at the end of the webinar, or we'll include them in a follow-up FAQ document. So if we don't get a chance to answer them during the webinar, we'll be sure to answer them during the FAQ. So as you're going through, if you have questions, please be sure to put them in the chat. Also feel free to introduce yourself in the chat with your name and program and pronouns, as well as your organization and title. You can also share why this topic is important to you. Alrighty, so just for some context, the Illinois Medical Respite Capacity Building Initiative is a direct result of the Home Illinois Plan. It established the Interagency Task Force and the Community Advisory Council in 2021, which includes 17 Illinois state departments and agencies, including IDHS, and over 100 processes, programs, and policies to develop a comprehensive plan to combat homelessness. The goal of the plan is to prevent shelter entry and, where unavoidable, ensure that shelter stays are limited and lead to quick transitions into stable living situations. Medical respite was identified as a key activity within the plan. In July, HB 2831 codified the task force into law, continuing their important work and ensuring their mission is protected by state law. Governor Pritzker's FY24 budget affirms this commitment, including this continued funding for the Illinois Medical Respite Capacity Building Initiative. And the Illinois Public Health Institute is a nonprofit public health organization. As our mission states, IPHI mobilizes stakeholders, catalyzes partnerships, and leads action to improve public health systems to maximize health, health equity, and quality of life for people and communities. Since 2017, IPHI has been working at the intersection of housing, homelessness, and health, and has facilitated systems collaborations and systems development initiatives. This work led to our partnership with IDHS to develop this capacity building initiative. From March until June of this year, IPHI awarded 11 communities with funding, technical assistance, and alerting collaborative led by NIMARC, which Julia will introduce in a moment. We are so proud of the work that our awardees accomplished during this award period, assessing the need for medical respite in their communities, establishing meaningful partnerships with stakeholders, engaging people with lived expertise in their planning, and developing new plans for new or expanded medical respite services at their sites. This next phase of capacity building awards builds on the last, advancing those plans toward implementation and expansion and inviting new communities to participate as well. And then I will now pass it off to Julia to introduce the National Institute for Medical Respite Care.
Thank you, Rachel. It's good to see so many familiar faces and names on this call, but for those of you who haven't met me or haven't had the chance to meet you, my name is Julia Dobbins, as I said, and I work for the National Healthcare for the Homeless Council. The National Healthcare for the Homeless Council has been doing work in medical respite care for the last 20 plus years, and we launched the National Institute for Medical Respite Care in the summer of 2020 really to expand our support for communities as they're developing their medical respite programs. And that is something that's kind of cool and unique about Illinois' work in building the ecosystem of medical respite care across the state. Is there's a real focus on not just saying good luck with the development of your services, but here's also some one-on-one technical assistance and support to really help communities build sustainable programs that are going to really support the folks in your community who need this level of care. So that's a little bit of what NIMARC does. We do a lot of on-the-ground support for communities as they develop their respite programs. And then also with NIMARC, we've been able to do a lot more systems level work. So not just in specific communities, but really thinking through how do broader healthcare systems and state governments implement support so that communities can develop and sustain their medical respite services. Next slide, please. So before we dive into the different tracks for this specific grant opportunity, I just want to level set briefly around how we define medical respite care. So medical respite care is short-term care for people experiencing homelessness who are too ill or frail to recover from an illness or injury on the street or in shelter, but not sick enough or ill enough to require hospital level care. So it really is short-term residential care that gives people an opportunity to rest, to recover, to connect, and to heal in a safe environment, while also having the opportunity to access some clinical oversight and be connected to supportive services. There is a lot of diversity in what medical respite can look like. This is a strength of medical respite care. This is something we want to continue with medical respite. There's no cookie cutter. This is exactly what your medical respite program should look like. So there's a lot of opportunity across the state to figure out what makes most sense in your specific community with your specific folks in terms of what your program should look like. The services you provide, the location, the staffing, all of those pieces are really flexible here. And it's our work through NIMARC to help you figure out what the best plan is for your community.
Great. Thanks so much, Julia. I'll continue just by going over some background for this award period. So for this request for applications, we are hoping to support up to 20 Illinois communities to plan for, implement, or expand medical respite with funding, technical assistance, as well as learning collaborative meetings. This request for applications will support 3 tracks of applicants. Track 1 is for medical respite planning applications. We intend this track for communities hoping to develop a plan for new medical respite services, and we'll go more into the differences in the tracks later on, but this is just a preview. Track 2 folks would be medical respite pilot implementation applicants. This track is for communities hoping to implement an existing plan for medical respite services in their community. And track 3 is for medical respite expansion applicants, and that is for existing medical respite providers. So folks who provide services just like Julia kind of went over, that are hoping to expand their services. Okay, so let's talk a bit about the award components. The award period will last from October 2nd until June 30th of next year. The award amount will vary by track. So track 1 or the planning applicants will be eligible to receive between $50,000 and $75,000 total. Track 2 and track 3 applicants, which are pilot implementation applicants and expansion applicants, will be eligible to receive up to $100,000 for the award period. That will be paid out, 25% of the budgeted amount will be paid out upon execution of the agreement that we sign at the beginning of the award period, and the remaining 75% will be paid on monthly cost reimbursement invoices after that initial 25% is depleted. As it notes here, all invoices must be received by July 5th. We will also be requiring some reporting, both for performance and financial. This award period will be requesting periodic performance and financial reports. This reporting, the formats will be provided by IPHI, but every 3 months we'll be requesting that you give us a performance update as well as a financial report update and invoice. And then at the end of the award period, we'll also be requiring a final summary report, as well as a financial report or your final invoice. That final summary report will have a format provided by IPHI as well. All right, I'm going to move into award expectations. This will be broken down by each track. So for track 1, which again is the Medical Respite Planning Award, you'll hear me repeating myself over and over, just repeating what track is for what, just to make sure we're clear. So again, track 1 is for the planning awards. They'll be expected to assess the state of medical respite capacity in their community and develop a plan to increase local capacity. That includes identifying successes, opportunities, and barriers to implementation, as well as the stakeholders and partners involved. Like the other tracks, they'll also be expected to engage in at least 4 meetings for technical assistance with Julia and her team at NIMARC. And attend the 5 virtual learning collaborative meetings. Julia will go a little bit in depth on what those technical assistance meetings and the learning collaborative, how they'll play out a little bit later. We also hope that folks in track 1 will contribute to policy discussions related to opportunities for Medicaid. So most of you are aware that the 1115 waiver, which includes a potential benefit for medical respite, was submitted to CMS by HFS. And we are hoping to continue that discussion with HFS on implementation for the potential medical respite benefit. And we hope that awardees in this track and all tracks will help to contribute to those policy discussions. We also hope that you'll contribute to system collaboration building for medical respite care, as we're hoping to expand capacity at existing sites and build new sites and new communities. We're hoping to really build a collaborative around those communities, and we hope that you'll engage with us to build that. We also are going to require that you engage people with lived expertise in your planning. Moving forward to track 2, a lot of similar expectations here. So they'll be expected to assess the state of medical respite capacity, contribute to those same policy discussions and collaboration building, engage people with lived expertise, and attend the TA and learning collaborative meetings. What is really different about this track is that we expect you to implement a plan for medical respite care services at your site, with some services being operational by June of 2024. So this is really intended for folks who participated in the last phase who are ready to implement a pilot at their site. For track 3, again, this is for medical respite expansion awards. Again, a lot of the same expectations as the first, so they'll be expected to assess the state of medical respite capacity, engage in the technical assistance and learning collaborative meetings, and contribute to policy discussions and collaboration building. They'll also be expected to implement or develop a plan to implement an increase in capacity for medical respite at their site. So that could include identifying successes, opportunities, and barriers to implementation, the stakeholders and partners involved, or implementing a plan that you already have to increase capacity at your site. All right. I think I will now pass it off to Julia to just go a bit in depth on what the technical assistance and learning collaborative will look like.
Yeah, so like I said earlier, what's unique and I think really cool about this grant opportunity is that there is opportunity for more in-depth technical assistance, and there's a lot of best practice already out there about how to start a program, how to pilot a program, and how to expand a program. And our goal with these one-on-one TA sessions is really an opportunity for us to get to know you and your community and what you're hoping to develop or expand, and really thinking through how we can support that work. So how we can connect our network of resources with what you're trying to do. So many people have been in this space before and have figured out how to make this work. And so we want to make sure you're not having to reinvent the wheel if somebody already has a really good template that we can share. So really the goal with the one-on-one TA calls is to problem solve with you, to help you address challenges, to provide resources, to provide feedback when that's helpful, and just to support you throughout this time of the grant and whatever your primary goals are for the grant. And then more broadly for the Learning Collaborative, this is pretty unique what's happening in Illinois right now, this real focus on building this ecosystem of medical respite services. And so we are going to bring the full cohort together for a couple of 5 learning collaborative sessions where part of that time will be spent on some didactic information that's relevant across all 3 tracks. So sharing some best practice, sharing some experience from subject matter experts, bringing in panels of medical respite providers to talk to you about their programming or how they've addressed challenges. And then we're going to have some time as well to break out into smaller groups, because we'll have people all across the board as part of this cohort and where they are with their medical respite programs. So we'll want to make sure that there's time for you to be with some of your peers in this space who are in a similar, who are just at a similar point in the development as you are. And I think the other piece that's kind of exciting about this to go along with the Medicaid piece is Illinois is one of the first states. There's only a handful of states that are pursuing medical respite right now as a reimbursable service. And so that's something that we'll be talking about in our cohort over the next several months is how can we make sure that when that goes into effect, and hopefully it will, that your program, either the program that you've established and been operating or the program you're developing, is ready to move forward as a reimbursable provider when that does go live.
Awesome. Thanks so much, Julia. Okay. So now I'll just discuss a bit about eligibility criteria. I'll start with general eligibility criteria and then move into eligibility for each specific track. So organizations are considered eligible to apply if they have the capacity to execute the requirements of this project, including direct experience working with homeless populations or a partner that has experience working with homeless populations, ability to convene relevant stakeholders and partners, capacity to dedicate staff time to manage this project, and the capacity to manage the funds and produce financial and program reports. In addition to your responses to the application questions, we will also consider elements like geographic location, organization type, and community served to ensure we select a diverse set of awardees. We encourage applicants serving the same communities or service areas to partner so that efforts are not duplicated. Applicants must also include engaging people with lived expertise in their application and proposed budget to be considered. So eligibility criteria for track 1 applicants, again, this is for medical respite planning awards. They must meet the general eligibility criteria. And I just want to note here that new applicants who did not participate in the first phase of this initiative can apply to this track, as well as applicants who did participate in the first phase of this initiative, but they do not quite feel ready to implement a pilot program and would like to continue their planning. They're also invited to apply to this track. Moving on to track 2. Again, this is for medical respite pilot implementation awards. Again, they must meet the general eligibility criteria, but specifically, they must have participated in the first phase of this initiative. They must also have a detailed implementation plan that supports your program being partially or fully operational by June of next year. We'll go into what that implementation plan will look like in just a moment. But they must also have identified a facility or site for their program to operate in. Moving on to track 3, this is for medical respite expansion awards. Again, they must meet the general eligibility criteria, and they must be an established medical respite program. Just a reminder of what Julia shared with us at the top. We define medical respite care as acute and post-acute care for people experiencing homelessness who are not ill enough to remain in a hospital, but are too ill to recover on the streets. So again, please note it is not a nursing home, skilled nursing facility, or a street medicine program. Applicants who participated in the first phase of this initiative are welcome to apply, as well as applicants who did not participate in the first phase, but do have an established medical respite program. Okay, just quickly going over our priority areas. We are specifically seeking organizations that serve people experiencing homelessness, organizations that have geographic reach in or prioritize serving vulnerable communities, those that provide behavioral health or substance use services, and those who have a commitment to housing first and low barrier services. Just want to show this a slide with the timeline. This timeline is included in the RFA, so don't worry about trying to jot down all of the dates and times here. I do want to highlight the office hours, which are coming up this Wednesday and Thursday. In the next slide, I'll go into them a bit more, but these are the dates and times for them. So that's Wednesday, August 23rd from 2 to 4 p.m. and then Thursday, August 24th from 8 to 10. And then pulling out some other dates from this timeline, applications are going to be closing on September 13th at midnight. And awards notification will happen on October 2nd. October 17th will be the awardee orientation. And then from then on, we will have our learning collaborative meetings until the end of the award period. All right, so this is the submission overview. Just want to start off with an office hours explanation. So office hours are specifically for Track 2 pilot implementation applicants. Again, this is only for folks who participated in the first phase who are hoping to implement a pilot program at their site. These office hours will be used to speak with Julia and I to just discuss how the last award period went, to discuss your implementation plan and if you feel ready to apply for this track. So again, those office hours will be Wednesday, August 23rd from 2 to 4 p.m. and then Thursday, August 24th from 8 a.m. to 10 a.m. If you're interested in applying for this track, please email Elise at the email listed on the screen with the subject line IMR-CBI office hours to schedule an appointment. I know that some of you have already reached out to get in touch. Elise and I will be scheduling those meetings between this afternoon and tomorrow morning, so you should see some calendar invitations coming to you. But if you have not reached out yet and you are planning to apply in that track, please reach out as soon as possible so we can get you scheduled. If for whatever reason you don't think that a representative from your organization can meet with us during those times, please reach out still and we'll try to work something out outside of those hours. And then what materials should you submit? When you get to the questions section of the RFA overall document, you'll see that there are general and track specific questions. All applicants must answer the general information questions, but each track should only respond to the track specific questions for the track that they're applying for. These questions can be completed in a separate Word or PDF document and submitted along with the proposed project budget and letters of support from senior staff and partners. That application and materials should be emailed to me at the email listed here with the subject line Medical Respite RFA. Again, applications will close on September 13th at midnight, so be sure to get your materials in no later than that date. Okay, so now we're just going to go into a bit of what each track specific application will look like. So the application for track 1 medical respite planning is intended again for organizations that don't have an existing medical respite program but want to build capacity for one. They are required to apply in collaboration with one or more community stakeholders to support the project. So you'll note that track 1 folks will be expected to submit a letter of support from one of their partners. Applicants in this track will also be asked to describe the need for medical respite in their community, their organization's initial ideas for building capacity, and the strengths and barriers to building that capacity for medical respite. Moving on to track 2, pilot implementation. So again, this track is intended for organizations that participated in the first phase who already have an existing implementation plan that they worked on during that phase. An actionable implementation plan will include your list of partners and the role that they'll play in implementation, a detailed project timeline, anticipated referral sources, your anticipated program budget. So that is not the budget for this initiative, but for your actual medical respite program. Also an anticipated staffing plan, which medical respite program model you plan to have at your site, the anticipated number of beds, and the planned medical respite facility type, as well as the anticipated length of stay at your site. And then again, just reiterating that the applicants in this track are expected to have all or some parts of their program operational by June of next year. So we're hoping to see some really robust plans that have that kind of start date in mind. Moving on to track 3, medical respite expansion. This track, again, is intended for organizations that already have existing medical respite programs at their site who are interested in expanding capacity. While they're not required to apply in collaboration with a stakeholder, they are encouraged to share their existing or potential partnerships that would facilitate capacity building or expansion. They'll also be asked to describe their existing program, their ideas for expanding capacity at their site, and the barriers to that expansion. Okay, moving along to budget information. So the maximum budget for this project for track 1, which is the planning track, is $75,000. And then it is $100,000 for track 2 pilot implementation and track 3 expansion applications. Allowable costs, these are listed in the RFA, but they include salaries, fringe, consultants or contractors, supplies, travel, occupancy, printing, communications, training, meeting costs, and other costs, as well as indirect costs. Budgets must include compensation for people with lived expertise in the consulting or contracting line. As I mentioned in the eligibility requirements, we do require you all to engage people with lived expertise in your planning, and they must be budgeted for. Also want to note that equipment purchases over $5,000 may require additional approval, and capital expenditures are not allowed. We do hope to provide you all additional information on allowable costs, specifically for the pilot implementation applications. We hope to share this information with you all during the office hour meetings, as well as in the FAQ document that we hope to publish. All right, so I think now we are going to pause for the next 10 minutes or so to answer some of you all's questions. So Elise, do we have any questions in the chat so far? We'll answer them in the order that they were asked.
Sure, let me browse through. We have a lot of introductions, so thank you all for that. Our first question is more along the lines of, can we have a copy of this PowerPoint after the presentation?
Absolutely. So this presentation is being recorded. We'll make sure to share the recording with everyone who registered, as well as everyone who is on our stakeholder engagement list. And we'll also share these slides, so you'll have the ability to view them at your own pace.
Awesome. Thank you, Rachel. We have another question from Eugenia for track 2. The funding is not for the actual implementation, but for the planning.
So again, we'll be able to chat with you a bit more during office hours to share exactly what is going to be allowable with the funding. We just want to confirm before we share with you all, confirm with IDHS what is allowable and what is not. But the funding should primarily be for the planning, but also some elements of implementation, which we'll be able to share a bit more. I know that this answer is a little bit vague, but we're just hoping to get clear information from IDHS before we share with you all, so that you all can, build this funding opportunity into your existing plans to implementing the pilot. So it can be used for things like staff time, all the things that we listed before. But I presume it could also be used for some of the startup costs for piloting a new program, but we just want to be sure that we can tell you all exactly what those costs are that will be reimbursed by us before we share it here.
So, thank you, Rachel. And we have one more question from Julie Shepard. Can you explain more about the status of the waiver for respite care in Illinois?
So right now, I know that HFS has submitted the waiver to CMS for approval. I believe that they're still in negotiations with CMS, but that the outlook is positive. And I believe that the timeline for implementation is shifted to the fall of this year. I think that potentially there are some other folks from IPHI on the call who may be able to shed a bit more light, but I think that is the status as of now. I know that we are still in contact with our colleagues at HFS who are working on getting the waiver approved by CMS, and we'll continue to be in contact with them pending approval for implementation. But I'll open the floor for any other IPHI staff who may have some additional information.
Thanks.
Can you
go ahead?
Yes, we can do that.
Okay, I think Eugenia's question was for track 2. She said the funding is not for actual implementation, but for planning. And I believe track 2, the funding is for implementation, and you have to have something up and running. So it wasn't a question, what can they spend the money on? But yes, some sort of pilot or startup, maybe Julia or Rachel, you could explain that a little bit better, is what track 2 is for. And it's only for those who already went through the planning. Eugenia is asking if she can maybe come off mute and ask her question that way.
Yes, absolutely. Eugenia, please do come off mute and ask so we can get you an answer.
Sure. So it's a combination of both. Thank you so much for acknowledging my question. Because the implementation, you said that you should have something ready to kind of go on June 2024 for the implementation piece. But that's the end of the grant. So that's why I'm wondering, like, is the money for actually implementing what you come up with? Or like, I think maybe when you talk about what you can spend the money on, it'll bring clarity in terms of what you should spend the money on from October to June if the money is not to be used after June 2024. I guess that's what I'm thinking in my mind, like the deadline versus when the implementation is to take place. It doesn't seem to coincide with me. So that's what I'm trying to make sure.
Absolutely. I appreciate you coming off mute to share that because I think I understand your question a bit more. So yes, similar to what Alyssa was saying, for track 2 folks, we do expect you to implement a plan that you've already created to pilot a medical respite program. We do not expect that the funding from this award will be the primary funding source for that medical respite program that you all are developing. We anticipate that you all will come up with additional funding plans, and that funding plan is actually like one of the components of the proposal that we're asking you all to submit for the track 2 implementation track. So this funding is not intended to be like a primary or sustained source for that medical respite program. It is just additional funding to help get the pilot off the ground, if that makes sense. Does that answer your question, Eugenia?
Yes, thank you.
All right, Elise, were there any other questions from the chat?
Let me see if any new ones have come in. Sorry, y'all, I'm on my phone.
No.
It looks like we do have one more question, and feel free to come off mute.
Hi, I currently am employed at Will Grundy Medical Clinic. We are a free clinic where we service all of the individuals that you spoke in this PowerPoint. But currently we're in the process of to be a FQHC, but not right now. We're just a free clinic, so we provide free services. Could we still possibly apply? Because I believe my executive director has been trying to apply for medical respite, but has been not granted. We operate a hotel for housing. We have a nurse practitioner. We have a lot of the criteria for this, but I think one of the criteria of to be as FQHC, which currently we're not right now.
Thanks for this question. So I don't believe that you actually have to be an FQHC to apply. I just want to note that it seems like you would be planning for a new medical respite program as opposed to an existing one. So if you do decide to apply, it seems like you would fall into the track 1 planning track. So yes, I believe your organization is welcome to apply, even though you're not an FQHC.
Thank you. I'll let my executive director know.
Thank you.
We have one more question so far. As a follow-up to their previous question, Julie would like to know, can you give some examples of funding sources that other communities have used to sustain respite care?
That is a great question. I'm going to pass that over to Julia because I think she has a bit more expertise in different funding sources.
Yeah, happy to share, Julie. So this is the complex web of medical respite care, is that there is not a singular funding source that most medical respite programs rely on for full sustainability. Most programs have 3 or more funding sources to maintain their services. This is part of the reason why Medicaid reimbursement is such an exciting new opportunity in Illinois for consistent funding reimbursement for medical respite. But a lot of programs partner with their hospitals, and there's some financial support from hospital partners or other local community partners, a lot of foundation support for medical respite programs, other grants, whether local or state grants. There's some national health foundations that provide a lot of support to medical respite care. Most respite programs, their financial structure is local. So it's coming from community partners who are referring clients into their program. And that can be an annual grant. It can be a per diem rate or reimbursement rate. And then local grants as well to support their services. This is one of the reasons why a lot of medical respite programs operate in partnership with other organizations. So they bring the resources that the community has. So maybe it's a shelter partnering with a health center or something similar to that, or maybe it's a homeless service agency that does have hotel or motel space. And so they partner with a free clinic to come in and provide care. So there's a little bit of a patchwork here of how programs are funded. And that's something we're happy to talk to you more about, to strategize with you about funding opportunities for your specific program and community.
Absolutely. Thanks, Julia.
And we don't have any more questions in the chat. So anyone feel free to come off mute. Oh, we do have a follow-up question, Julia. Can you also clarify how the programs are typically staffed?
Sure. And I'm going to throw a couple of resources in the chat as well. And actually, I'll send them to Rachel as well so she can send them in a follow-up email. There are different models of what medical respite care can look like, and we have some resources on explaining those different models and then explaining some examples of staff structure based on the model. So it just depends on the level of acuity that you're addressing in your medical respite program. So if your program is a lot more focused on care coordination, so there's not necessarily clinical care happening on site in your program, but maybe there's a lot of coordinating doctor's appointments and case management around that. Programs will have social workers, community health workers, case managers. But then as you go up, if you're treating folks or you have folks coming into your program who have more acute issues, maybe they have wound care needs or they have IV meds or they're recovering from surgery where they need a little bit more of a higher clinical touch, then a lot of programs have nurses or they partner with a health center or a clinic that will come in and provide that clinical support. So it really just depends on the model of program you're trying to develop and the acuity level that you're trying to address within your program. And then, of course, the other piece is just the administrative side as well. Somebody to be, you know, grant management, admin, all of those pieces. But yeah, I'll send these resources to you, Rachel, so you can include them in the follow-up.
Absolutely, that would be great. Thank you.
It looks like that's the last of the questions, unless anyone wants to come off of mute.
All right, hearing none, we will move along. However, if you do have a question, please be sure to reach out to me directly. You can send questions to my email, which is listed in this second tab here, rachel.thomas@iphionline.org, with the subject line medical respite RFA question. We'll be sure to include all the questions that were asked during this informational webinar as well as detailed responses in that FAQ. And it will be published the following week. I believe the deadline to send those questions is September 1st. You can also find more information on this initiative on our website. Just a reminder to submit completed RFA documents, budget forms, and supplementary materials to me as well at the email address listed there. And then once published, the FAQ document will live on the website, and you can find it by scrolling down and clicking Go to FAQs. All right, and that is all. Thank you all for your time and for your questions and attention. I'm so excited and very much looking forward to reading all your applications and potentially working with you all during this award period. Thank you.
Thanks, Rachel.
Thank you.
Have a wonderful afternoon, everyone.